I want to turn a little bit to the management of chronic illness. So when we're talking about this, we're sometimes a victim of our own success. There are advancements in treatment, but with that comes sometimes a significant added cost, whether it's specific treatments that are very expensive or ongoing treatment, whatever it might be. So how can we ensure that there is still sustainability in the healthcare system, even as advancements and costs along with that increase?
Actually, we think there's a way forward here, and we're pretty certain of it. Let's take high blood pressure. High blood pressure is the most deadly undertreated condition in the United States. You can save more lives in the United States and around the world among adults through better treatment of high blood pressure than through better treatment of any other condition. And we now know definitively that starting at a blood pressure of 115/70, your risk of death from a heart attack or stroke doubles with every 20-point increase in your blood pressure. We also know definitively that lower is better, down to at least 120/80. That doesn't mean everyone should aim for that blood pressure. That's something to discuss with your doctor. But we know that the medicines that are most effective to treat people with high blood pressure are safe, generic, inexpensive, effective, and can save your life. One of the great ironies of healthcare is we tend to overtreat symptomatic conditions and undertreat asymptomatic conditions, and the paradigm of that is hypertension. It's called the silent killer for a reason. And yet, if we look at healthcare systems around the country and around the world, they can get to 80–90% control rates using simple, straightforward algorithms where you use a protocol that's been developed by physicians. It can be implemented by physicians or by nurses or by pharmacists or by others under a physician's direction. And when you follow those protocols, you get much better care. You get more control, less risk of stroke, heart attack, kidney failure, adverse events. And we really need to scale this up. What we've seen in the US, sadly, is that we've gone backwards. We have a lower level of hypertension control than we did a decade ago or 5 years ago. And to improve that, we need to get it right. That means first, keeping it simple. For the vast majority of patients, a straightforward protocol, starting with 1 or 2 drugs, advancing within a week or two if there isn't control, advancing more in a week or two after that, can quickly bring blood pressure under control and save literally about 100,000 lives a year in the US just by improving care of this one condition. Not only would it save lives, it would prevent heart attacks, strokes, reduce the need for everything from cardiac surgery to stroke rehabilitation. So it's not just a matter of saving lives, it's a matter of making our healthcare dollar actually maximize health. And we can do that by better managing chronic disease, better managing especially hypertension, and that means using simple protocols. That means eliminating barriers for patients, using telemedicine. That means using team-based care. So every member of the team is doing their part to support the patient. And it means looking rigorously and being brutally honest about what the data shows. What's your level of blood pressure control? And when we look at that carefully and don't allow health systems to drop off the people who didn't come back for care, we're not doing nearly as well as we should. Not only is this the leading cause of death for all Americans that's preventable, it's also the leading treatable cause of death that causes the largest disparity between life expectancy in Black and white Americans. Tobacco remains the largest preventable cause of death. Hypertension is the most treatable health condition in terms of the lives that could be saved.